Hey everybody, yeah, it's Fender from the grave. You thought you were through with me, didn't you? I needed to give you instructions on what to do with regard to our test, and I got rid of the video of my face because that would just scare you. Second period and seventh period, you're going to be taking the A through M medical abbreviations test. Make sure you have your flashcards with you. They may come in handy, who knows. Then at the end of your test, you're going to turn in your notebooks. Y'all just get some of those green paper recycling bins and empty them out and just stick your notebooks in there. Okay, make sure you get everything out of the flaps. Make sure your rubric's the first thing I see. Alright, so third, fourth, and sixth. Sixth, you've already seen the rest of this, so you're just going to be taking your test and you're going to turn in your notebook when you get through, because today's the day for you guys. So you're done. Third and fourth, however, there was like 3 slides we hadn't seen yet. So here are the slides, okay? I think we'd gotten most everybody to New Age. And we had Gerhard de Mank, we had Ivanovsky with viruses, we had Sigmund Freud with psychoanalysis, the father of modern psychiatry and psychoanalysis. We had, oh, come on. We had, there he is. We talked about him. Alexander Fleming, with the invention of penicillin, and then we had Sabin and Salk, which worked with polio. They used, Salk did a dead version and injected it for vaccination, and Sabin did a live version before he became a football coach at Alabama. Key nurses, and I'm sorry the fonts are going to be off because I'm using this other laptop, but key nursing is Florence Nightingale. Got to understand that nursing was thought of as the scum of the earth back in the 1850s. If you were a nurse, you were a rehabilitated prostitute, alcoholic, or drug abuser. So it wasn't a very respectable profession until a young lady who had some family wealth, Florence Nightingale, decided she was going to turn that around, and she made formal education and training for nurses and started bringing respectability back to it. Other things that she accomplished. She accomplished the ward system. Back in the old days when you went to the hospital, it was just one big old room, and you sat in there with you have a broken arm, but right next to you in a bed could be somebody with a plague, and right beside that person could be somebody delivering a baby, and you know, it was kind of crazy. So she realized, because of nosocomial infection, it should be still written up on the board from when I talked about it to the other class, which nosocomial infection is when you catch something from the facility. Like, we used to have this dog that we took to the vet at Auburn, and every time we took her, she got ear mites. She got it from the vet, and they would go ahead and give us ear mite drops to get rid of them, but that's a nosocomial infection. The number one cause of death in the elderly in retirement homes is pneumonia that they catch in the healthcare facility. So she said, let's take everybody and let's divide them out. Let's put the orthopedics in one area, let's put the pediatrics in another area, and keep everybody separate, and then we can keep from spreading disease. She also did the environmental controls, where they did a really good job of cleaning the room, looking into air filtration and all sorts of things. The last thing that she's noted for is not the greatest of things. It was not horrible either. It's called the Nightingale effect. She was a nurse, as I said, during the Crimean Wars in England, and she she had a particularly rough burn case. They made it into a movie a while back. I can't remember the name of the movie, but the burn case, everybody had given up hope on him. He had gone out in a blaze in his airplane and crashed, and the infection kept setting in, and they kept saying he was going to die, let him go, and she wouldn't believe in that. So she took him off and separated him out from everybody and took care of him 24/7. He got better. The bad thing is, she fell in love with him. And that's a common thing that happens now amongst nurses when they over-involve themselves in the care of a patient. And it's got a term, and the term is the Nightingale effect. Clara Barton. Clara Barton was during the Civil War. She is the founder of the Red Cross, because now we had a rather unique system of war in that we got brother against brother, fathers against sons. You couldn't tell who was on one side or who was on the other, and word of injured, that was Miss Fender, injured or dead family members didn't get back well. Well, she invented a system with the Bureau of Records that helped keep track of all that. She also did the dog tag system that we use now. If you see the dog tag system, the dog tag that's drawn up on the board up there, the dog tag, one is put with their records when their body is brought in, and the other is wedged between their teeth so that it doesn't become separated from the body, so they make sure that they have identification when they get back to the States. But big in the Red Cross. She's the founder of the Red Cross and the Bureau of Records for keeping up. And the Bureau of Records also, I saw a TV show not too long ago that did a job on reuniting a brother and sister who were separated during the Jewish Holocaust. So, and they were like 70 years old now, but it was kind of cute. Watson and Crick. There's a picture of those guys. They are the discoverers and mappers of DNA, deoxyribonucleic acid. It's the template for making everything in your human body. It's genetics, it's DNA testing, it's RNA production, it's all that kind of stuff. So Watson and Crick. I think one of them's still alive. Can't remember which one. The other one has passed away. And Christian Bedard is still alive, from what I understand. He is a South African physician who did the first successful heart transplant. Important things to remember, key terms, FYI, for your information. Here we go, real quick. Invasive versus non-invasive. An invasive study is any study that requires puncturing the skin. So if I give you a shot, that's invasive because I have punctured your skin. If I rub ointment on your skin, that's non-invasive because I didn't puncture the integrity of your skin. Geriatric, that's old people. Pertaining to old age. No, I'm not quite there yet. Although I feel like it. Recipient, well, that's a hard one. One who receives something. Asepsis and antiseptic. Asepsis, A means without or not, sepsis means rot. It is a condition that's clean, without rot or decay. It's where we talked about Lister and all them taking stuff and cleaning tabletops and doing that before they did a surgical procedure. The substance that they used was an antiseptic. Anti without means against. Sepsis means rot or decay. So it's a substance that's used to clean the body part or clean the tables and instruments and what have you. Anesthesia. An means without or not. Anesthesia means feeling. This is a substance that's used to make you without feeling during a surgical procedure or something. Unlike the old days, they don't keep you asleep during surgical procedures anymore. And I can answer the questions about that a little bit later. Dissection, to cut apart and study the sections. We talked about that during Leonardo da Vinci's time. Observation is to observe or watch for purpose of study. Early drugs. Aspirin. Dr. Baer, he noticed that that the Indians chewed on a willow tree bark, and when he analyzed it, he found that it had ASA, salicylic acid, which is a painkiller, or an analgesic, removes pain. And he compressed it into a pill, and it later became aspirin, and that's where Baer, the company Baer, came from, was Dr. Baer. He was one of these traveling in a wagon doctors way back in the day. But it's a miracle drug. It can regrow cartilage. It can thin your blood if you have heart conditions. It can do all sorts of things. However, a warning: if you catch the flu like I've got, it is not good for teenagers to take anything with aspirin in it. You can suffer from Reye's syndrome, and you don't want that. You wake up the next morning drooling and unable to move, and you're that way for the rest of your life. So do not take an aspirin product while you have the flu. Belladonna. Belladonna, they said it kept away were creatures. They also said that it gave women big eyes, which was something beautiful back in the day for you to have big eyes. But now we also use it for regulating heartbeat. Morphine, opiates coming from poppy seed, the national flower of Afghanistan. It is a high-level painkiller. It comes from poppy. Quinine, digitalis, coming from foxglove. It's not so big. Quinine comes from the cocona tree, and it helps with fever and muscle spasms. Digitalis comes from foxglove, and it's a type of flower. I don't have pictures of them on this one. I got it on the other one. It helps regulate heartbeat, irregular heartbeats and stuff like that. Okay? Quinine, we still give that sometimes to athletes for cramping. Last one, increase of average lifespan. Yes, way back in the day, with Methuselah and Moses, theoretically somebody could live to be 800 something years old, because you got a pure genetic structure and very little disease. Plus, you've got a God who's trying to populate a world. So, it's only smart to do it that way. But then over time, with the advent of more predators and leaving the Garden of Eden and all that kind of stuff, you reduce the average lifespan of somebody. And then man gets thrown in there as our main predator. And during the 1800s, back during the Western time and all that kind of stuff, you look at a man wrong, he shoots you or stabs you or something. So your lifespan wasn't very long. Women's lifespan was even shorter because they were considered chattel, which is possessions. You traded them like you traded horses and guns and flour and that sort of thing. Time went by and women were held with more respect, but they still weren't in the workforce, and therefore their lifespan increased over man. Also, their body is pretty much made for longevity as compared to a man's, which is made to burn out quickly, be stronger and everything, but is going to die out quicker, where a woman's is not made for that. A woman's is made for the longer haul. But the average lifespan of a woman went to about 80 years of age, 80 and 90, while male was anywhere between 50 to 60 years of age back in the early 1930s, 1940s. Then, with the advent of more medical breakthroughs, man went up, got close to parallel with women, and then women's rights hit. And one thing that they didn't realize that they were getting with women's rights was to move into the workforce. And with everything that comes with the workforce, it causes their lifespan to to drop. They started dealing with the same stresses and hardships and accidents in the workplace that men had, and they started to level out. Still, a woman's lifespan is about 10 years more, so we're about 80 for men and about 90 for females at this time, although that is starting to drop off. We're seeing that it's dropping off drastically because of our choices of food and diet and eating habits. We're seeing a big swing in the average lifespan dropping off in humans right now. So watch out. No matter what, in Genesis, God said that that man will not live past 130 years of age anymore, and that has not happened since He said that. So there you go. All right. The end. Now you're going to. Hey, one other note. I forgot to give instructions for 5th period. Y'all have got your formal application with a small aptitude test today. You're not allowed to discuss while doing it. You're supposed to work on your own, but you are allowed to have your PRP handy. Sorry. And you're also not allowed to use a calculator. The test looks at basic math skills, so it wants to see that you can do it without a calculator. If I'm not back in time to do your investors report, what I'll probably do is sneak up there one day and set up the video camera and do the reverse. Make it to where you turn the video camera on and you give your presentation in front of the video camera. But hopefully, hopefully I can sneak back there by that time. All right. Thanks. Talk to you later. Bye.